So House File 287, I'll move that Representative Edelson's bill, House File 287, be laid over for possible inclusion in the Human Services Finance Bill. Representative Edelson, you have an author's amendment, I believe, labeled A1. If you would like, I'll offer that amendment for you so we can get it in the shape you would like before you discuss it.
Thank you, Madam Chair.
So I will move the A1 amendment. Would you like to quick speak to the amendment?
Yes, Madam Chair and members. The amendment ensures that that the practices are culturally responsive, as well, excuse me, as making sure that we have geographic representation as well as BIPOC community members represented in the study.
Okay, any other questions about the A1? All those in favor, please unmute yourself. Signify by saying aye.
Aye.
Aye. Any opposed? Okay, the amendment is adopted. Representative Edelson, to your bill as amended, please.
Thank you, Madam Chair and members. It's good to see you all virtually. I'm going to try to keep this pretty short because I know that we have several testifiers and not a great deal of time. House File 287 is pretty straightforward. It directs the Department of Human Services with stakeholders to conduct a study to make recommendations on sober homes. Sober homes right now in the state of Minnesota are largely unregulated. We have today here is the MASH, is the Minnesota Association of Sober Homes. They independently certify homes, and then they have a private investigator that they hire that does the inspections. And the guidelines that they use are from NAR, which is the National Alliance of Recovery Residences. But the critical thing I want members to know is not every sober home in the state of Minnesota is a part of MASH. So we have a gap. And so while MASH may have high standards, we have numerous sober homes, and actually we don't even know how many in the state of Minnesota that don't follow any of MASH's guidelines. So it's important to note that I support sober homes. I've been working with stakeholders and NAMI as well on this bill. Everyone understands that sober homes really provide an important part of the recovery process. So we know that a person's also very vulnerable during recovery. And it's important as a state that we provide protections and oversight. In the nation right now, we're seeing a trend of sober homes being looked at. How do we do consumer protections? Connecticut, Georgia, Illinois are all part of states that are doing it. There's many more, but these states have put in consumer protections without increasing cost, which is really important to note. So right now, before I go to testifiers, I just want you all to know that Minnesota is known as one of the meccas, one of the places to come to get sober and to stay sober. And it's really upon us, this conversation, to make sure that we're protecting people when they do come here and when they are getting sober. So Madam Chair, I'd like to move to my first testifier.
Thank you, Representative Edelson. The first up is Ms. Abderholden.
Thank you, Madam Chair, members. Sue Abderholden, NAMI, Minnesota. I think it's really important that you read the language of this bill. It's really about bringing together stakeholders to increase access to sober homes, promote person-centered planning and cultural responsiveness, and develop recommendations on oversight, not regulations, not licensing, on oversight, and then to provide the consumer protections. Sober homes do play a very important role, and we're just trying to ensure some basic consumer protections. People who live in sober homes are not considered renters, and they're not considered patients, so they have no rights under those sections of the law. 50% of people with a mental illness also have a substance use disorder, which is why people have called NAMI about concerns with sober homes and why we're concerned about this issue. The complaints we have heard include homes being dirty, infested with rodents, use of drugs in the home, people being evicted late at night with nowhere to go, people losing their deposits when they leave due to the poor conditions, and more. The letter from the Ombudsman also confirms that there are problems. And this is not just a state issue, it's a national issue. The 2018 support bill signed by President Trump mandated the Secretary of Health and Human Services to develop best practices around sober homes. The National Council on Behavioral Health and the National Alliance for Recovery Residents found there are inconsistencies in quality because there aren't state-enforced protections or standards. This report recommended that states adopt a common definition, establish a certification process, incentivize providers to adhere to national standards, and expand investment and technical assistance for recovery housing. SAMHSA issued a report on best practices for sober homes and include recommendations for states to define them and the services they offer, and advise that states adopt a process of certification to assure program quality. Good stories don't negate the fact that there are people who have had bad experiences. What we all want are safe, sober living homes so individuals can advance in their recovery. Thank you.
Thank you, Ms. Abderholden. Rory O'Brien, welcome to the committee. Please state your name for the record and proceed with your testimony.
Yes, my name is Rory O'Brien. And Madam Chair, committee members, thank you for the opportunity to speak today. My name is Rory O'Brien. I'm the chapter leader of Minneapolis Students for Sensible Drug Policy. We're the local ambassador chapter of the largest global youth-led human rights network dedicated to addressing the war on drugs through sensible policy change. I also studied addiction counseling at Minneapolis College and do harm reduction-based street outreach. Over the past 2 years, we have been interviewing and meeting with former sober housing residents and sober housing managers. Some of them have submitted written testimony to NAMI. While people did have positive experience at their sober homes, they also still had concerns about how homes were run and were worried about how they saw some of the other residents being treated. Out of the people who wanted to discuss policy changes, there were more negative experiences than positive ones. The stories range from the common stories of being evicted after returning to use or relapse, to see people being evicted for not doing their daily chores, to residents being evicted and having sober homes call their place of employment, to stories where, in just a matter of weeks, multiple evicted residents had overdosed. One common theme we have been hearing from people opposed to a regulated system is that sober housing is a choice. According to data from the state's Drug and Alcohol Abuse Normative Evaluation System, in 2017, over 17,000, or nearly 1/3 of the referrals to Minnesota treatment programs came from the criminal justice system. In our interviews, people who were experiencing homelessness said that they were mandated to attend treatment, but that sober homes were their only option for housing. When evicted, they were left to the streets with no place to go and no resources to assist them. For residents, many were unaware of MASH or how to file a complaint, or they prioritized finding new housing while navigating street homelessness. In addition, the former residents complained about the range of down deposits and rent. Rent seemed to be an average of $600 to $800 per month, with $500 deposits, which were often capped upon eviction, leaving many evicted residents with little to no money in their pockets. We've even heard of a rare home that is a MASH member charging up to $1,500 a month for added clinical services, but still without oversight. Another concern former residents brought to us is that most sober homes do not accept people on methadone or buprenorphine. For data listed by a popular outpatient treatment program, only 40% of the program's sober housing partners and only 35% of their MASH partners allow methadone. A fourth of their partners still do not even allow buprenorphine, also known as Suboxone. In 2017, 20% of all Minnesota treatment referrals involved opioid use disorder. Methadone and buprenorphine are the only approved treatments in the US that are shown to reduce risk of fatal overdose. With not only the media reports of overdose deaths at sober homes, but from the stories we have heard from past residents and being in an overdose crisis, these numbers are incredibly concerning. Additionally, the rights of people on medications for opioid use disorder are protected by federal non-discrimination laws, including the Fair Housing Act. Residents said that they had to make a decision to either be forced off their medication or struggle to find openings at the few homes that accept them while balancing treatment and the legal systems. Our organizations support housing first policy. We do not want to lessen access to people who require sober housing, but expand it. Our organization is comprised of members in recovery, former sober housing residents, addiction counseling, and mental health interns. And based on our discussions, we urge the legislature to consider an opportunity to develop an approach to regulations that will protect and preserve the human rights of sober housing residents. We support this bill to study oversight of sober housing programs and believe it is needed to protect our most vulnerable populations of people with substance use disorders. Thank you.
Thank you, Ms. O'Brien. Chris Edrington from MASH, please introduce yourself for the record and proceed with your testimony.
Hi, my name is Chris Edrington. I'd like to thank the committee for asking me to comment today. This matter is of great concern to us. I'm the co-founder of NAR, the National Association of Recovery Residents, mentioned by Representative Edelston. I currently serve on its board. I'm also a member of the MASH board, the Minnesota Association of Sober Homes or Sober Houses. I'm a founding member of both boards. And I operate St. Paul Sober Living, which is a sober living network of about 12 houses, about 105 beds in Minnesota mostly, and some in Colorado. And I've been doing that since 2001. Since its founding, NAR has similar relationships with the state affiliates. In other words, so MASH belongs to NAR as a state affiliate. There are 30 MASHs around the country and different acronyms associated with those states, many of which were formed in partnership with state legislatures and other addiction agencies on the state level. So for 10 years, we've been doing the work in the context of sober house oversight, both statewide and nationally. So I think that's one of the most important clear points to make today. NAR has developed the national best practices and standards for operating sober homes and other forms of recovery housing. So when somebody refers to a recovery residence, that's an umbrella term for lots of different types of sober houses. NAR has working relationships with the Substance Abuse and Mental Health Services Administration of the U.S. Department of Health and Human Services, the White House Office for National Drug Control Policy, National Council for Behavioral Health, the National Association of State and Alcohol and Drug Abuse Directors, and several other agencies and organizations. NAR is acknowledged by these and others as the national expert on recovery housing. Together with the National Council for Behavioral Health, NAR developed a policy guide for state legislatures and agencies, laying out the reasons for adopting that model titled Building Recovery, the state policy guide for supporting recovery housing, which is this. And I've asked our administrator for MASH, Will, to email either a link or a document to anybody who wants it. So all you got to do is ask, and we'll send that to you. Together with the National Council for Behavioral Health, NAR developed a policy guide, which is the one I just remembered. And I think it's important, or the one I just mentioned. And I think it's important to understand that in the context of oversight of a sober living home and the day-to-day sort of milieu and the way that we operate that particular environment, when you hear about complaints and you hear about problems with sober houses, but you also understand the way that we do it and how important it is to keep people out of the house that are using, a lot of it starts to make sense. It can sound like it's on fire if you say that a whole bunch of people got kicked out when it was 10 below in January in Minnesota, but that's anecdotal and not necessarily relevant, although there are people who do get evicted at inopportune times. I think if you understand the context with this and talk to people at MASH, you'll have a much more thorough understanding of it. So together with the National Council, oh, I'm sorry, I already read that part. Let's see. What Minnesota really needs to do is work with experts, NAR and MASH, to implement the oversight framework that's outlined in that guide. As to a state-funded study, we have a better idea. Pending federal legislation, the Excellence in Recovery Act, Representative David Trone of Maryland is behind that, will provide funding for a more comprehensive study than one proposed here. There's no reason for spending tax dollars to do something that is less thorough. I'm happy to answer any questions you might have and also put committee members in contact with the experts at NAR or MASH and for a more in-depth discussion of supporting world-class system of recovery housing in Minnesota. Thanks.
Thank you, Mr. Edrington. We have two questions from members. I hope you're going to be brief. This bill was heard in Behavioral Health Division extensively with lots of testimony and questions. So really we should focus on the fiscal impact of the bill, which I believe the last fiscal note was $136,000. Representative Liebling.
All right. Well, thank you, Madam Chair. And you answered part of my question right there. But the other part was, and I think this is a great idea, Representative Adelson. Thanks for bringing it. The question I have is, how are these services generally paid for? I heard Ms. O'Brien sort of implied that a lot of the time it's out of a person's pocket. Is there any state or federal money that flows to help people pay for these services?
Representative Edelson.
Thank you, Madam Chair and Chair Liebling. It is all paid for by cash out of the person's pocket. It does not insurance. There's no coverage for it currently. There are states, though, who have adopted policies that have then used state dollars to help fund some sober homes. So, we really are trying to work with MASH in this process to really benefit everyone.
Thank you. Representative Rasmussen.
Thank you, Madam Chair, and I'll try to keep it brief. My question is for the bill author, Representative Edelson. Thank you for your work on this important topic. I had the opportunity a few weeks ago to visit and talk with a sober home in the district I represent and just hear their inspiring stories on their path to recovery. And they are currently not a member of the Minnesota Association of Sober Homes, which I know is explicitly included as a stakeholder in your bill. And so, Representative Edelson, my question is, will sober homes that are not members of MASH be included as stakeholders? And what advice would you give to me that I should communicate back to my constituents about how they can become involved in this process?
Thank you, Representative Rasmussen. Representative Edelson.
Thank you, Madam Chair, and Representative Rasmussen, thank you for your question. I think absolutely they should be included in this. I think the importance here is we don't want to be the hard-handed government coming down on people. What we really want is consumer protections. Sober homes do great work, and we want both that are part of MASH and that are not part of MASH. To what Mr. Edrington said is we might be the national expert, but we don't have protections necessarily here. And really, this study is really working with everybody from people that are in MIT-NASH to NAR standards to looking at, Representative Albright brought up in the bill before, many people have co-occurring issues. It's not they're dealing with sobriety, but they're also dealing with a mental health struggle as well. And so really making sure that we're involving as many people so that we really continue to be the place people want to come for recovery.
Thank you, Representative Edelson. Representative Rasmussen.
Thank you, Representative Edelson. And the only thing I wanted to add is, it's my understanding, I could be corrected on here, that a number of sober homes essentially receive housing support through counties as part of the funding mechanism. And I know there are some issues with that I've heard from conversations with sober home residents and administrators. So I hope that that's a part of this conversation going forward as well.
Thank you, Representative Rasmussen. Representative Albright.
Thank you, Madam Chair. My question goes to Representative Edelson. But I note in the packet that there is an amendment offered by MASH, and I'm wondering if you would speak to that and whether or not that will be taken up at some point by you, or how would we wish to proceed with that amendment based upon your concerns for it.
Representative Edelson.
Thank you, Madam Chair, and thank you, Representative Albright. So what is in the packet and what MASH had submitted was a delete all, and it was the Washington policy that they adopted. Now, we did look at that, and I truly don't believe that it's the best policy just to take what Washington did. We have numerous states throughout the nation that have adopted different policies. I think that the study of all the stakeholders coming together can look at what Washington has done, but they can look at what Connecticut has done. They can look at Illinois and see what works for our state and what works for people going through sobriety and people, the sober homes. So that's it's the delete all from the Washington policy. But I mean, it doesn't seem like at this point good policy to just adopt that without having all stakeholders involved.
Representative Albright.
Thank you, Madam Chair, and I would request if Mr. Edrington would speak to his delete all amendment.
Mr. Edrington.
I think actually John Curtis can speak to the amendment. He's on here and he wrote it. I didn't have.
Mr. Curtis.
Yes, the delete all, thank you for John Curtis. I'm the co-chair of MASH and one of the co-founders of MASH. The delete all amendment was taken in large part from the state of Washington, but it also used language from Colorado, some from Illinois. So, I mean, we kind of looked across the board at what other states were doing, and primarily partnering with the certification body in the state to, provide a national registry and also require that all people being referred to sober houses be referred to places that are on the registry, which doesn't require that people are on the registry, but it does say that if you want referrals from treatment centers and providers in the state, then you have to be NAR certified and MASH certified and meet the criteria.
Thank you, Mr. Curtis. Sorry to cut you off, but we are at time. This amendment was not before the committee, but was discussed in behavioral health. So I'm going to renew my motion that this bill, House File 287, be laid over for possible inclusion in Human Services Finance Omnibus Bill. Thank you, Representative Edelson for bringing the bill forward.